What does it take to win Social Security disability if your claim is based on chronic and unrelenting knee pain? Stay tuned, I'll tell you what I know. My name is Jonathan Ginsberg. I'm a Social Security disability attorney, and I frequently represent clients who have knee problems, and frequently that can be they've had some sort of an issue with the knee. It could be a fracture, it could be meniscus tear, it could be an ACL tear, it could be just bone-on-bone chronic arthritis in the knee. And what I find is that judges look at knee pain cases and they say, especially if you're in your 40s or 50s, that you need more than simply osteoarthritis. Basically, everybody who's 40 or 50 is going to have some knee pain. I personally, I play basketball for years, not particularly well, but I play. And of course, my knees hurt sometimes. So a lot of people have knee pain cases. What judges are looking for is a level of knee pain that is so severe it interferes with your attention, concentration, focus. And so what, again, we're going to look for, what a judge is going to look for is, number one, a firm diagnosis, which typically needs to be done through an MRI or some sort of a radiological test that shows this is what the damage is in the knee. So it's clearly diagnosed. Osteoarthritis, it needs to be really, really severe. It's much better if there's some sort of a structural problem with the knee that would explain why you're having this degree of pain. Number two, treatment options, conservative treatment options have failed, meaning that you've been given injections, you've been done physical therapy, you've been put on a brace, you've been given pain medications, but nothing seems to be helping your knee pain. Number three, judges are looking for situations where you have significant swelling in your knee, because again, that shows that this is an ongoing problem, tightness and swelling that impacts your ability to walk and to sit. If you've got a swollen knee, sitting in an office chair is going to be difficult. And ideally, we need the doctor to tell us how long you can sit before you need to stand up and move around. And I think the activity issues with knee pain cases are situations where you've got to stand up and move around. After 15 or 20 minutes, you've got to take a 10-minute break and move around, or you've got to have your leg extended because of the swelling, so you don't have all the swelling. You've got to have your knee drained because of the swelling, or they give you a diuretic to stop the swelling, to help the swelling. That causes you to have to go to the bathroom all the time. So you need to have something in your knee that is causing activity limitations, specifically sitting type of problems, because let's assume if you've got a bad knee that you wouldn't be doing a lot of walking or climbing ladders, ropes, scaffolds. You wouldn't be kneeling, crouching, stooping, crawling, but could you sit? Could you do a job with a sit-stand option where you're sitting for 10 or 15 minutes, but you're standing in place at your work site doing the job, then you can come back and sit down again. Can you do that all day long? So what we need is evidence that you need to take a break and lie down for an hour or two to let the swelling go down or let the pain go down, or you take pain medications that cause you to become very fatigued and tired and you've got to lie down, or you have to have your legs extended at waist level or higher to keep the swelling down and to keep the circulation going, because again, most employers are not going to let you do that. That's a work capacity problem. And of course, having something from your doctor saying, yes, this individual needs to have his or her leg extended, this individual needs these narcotic pain medications, or even better, this individual is a candidate for knee replacement. You see knee replacement in there, that's pretty significant because that's a major surgery. And let's face it, any surgery carries risks, and knee replacements in particular are a problem because if you have the knee replacement, you may end up with one leg shorter than the other. And that creates a problem as far as your gait is concerned and how it affects your back and your hips and so forth. And even with a bad knee, if you've got a chronic bad knee, it's going to change the way you walk. You may start having problems with the good knee. You may start having problems with your hip and back. These need to be documented by your doctor so that the judge sees that this is more of a systemic problem, not localized to the knee. It's not something that some ice and some salve can really help, but this is something that is affecting your entire life. It's affecting your sleeping. It's affecting your concentration because of the medications. It's affecting your focus because of the degree of pain. I would recommend you keep a pain diary so you you can explain to the judge that, over the course of month after month, you've had some days, 2 or 3 or 4 days a month, where the pain level is so severe you couldn't do anything. You could put no pressure on your leg at all. You couldn't walk. You couldn't get out of the recliner. And again, it's hard to remember what happened 2 years ago, but if you can talk to the judge and you can say, here's my calendar and here's where I made note of a really, really bad day, and I added it up, and I had 5 really bad days in May of 2018, 4 bad days in June of 18, 6 bad days in July of 18, you start to see a pattern there. And judges will find that very credible in many cases, and that can be used as very powerful evidence on your behalf. I think knee pain cases are also can be helped a lot by statements from former coworkers and supervisors. Coworkers can talk about the decline in your performance and how you needed extra help. Supervisors can talk about your need to take excessive breaks, or your inability to perform the duties, or your need to take days off because you're having really, really bad days. That type of evidence can be very, very persuasive in knee pain cases because, again, a judge might start the analysis by thinking, well, just isolate your knee, don't move it, and you can work. But of course, it's not that easy because, sitting for 8 hours with your knee in a bent position can be extremely uncomfortable and not something you could sustain over a long period of time. So knee pain cases do require specific types of evidence, types of testimony, but I want you to know that the level of pain you've got to have generally has to be more than mild osteoarthritis. It's got to be something where you're getting injections, you're getting narcotic pain medication, you're on call for a knee replacement. That's the level of pain, discomfort that you've got to have. And again, support from former coworkers and supervisors, support from your doctor can really tip the balance in your favor. Hope you found this helpful. If you need some more information, please go to my website, ssdanswers.com. You can download my Secrets to Winning Disability Survival Kit, or also ask for a free case evaluation. Happy to look at your case and the specifics about your case, whether it's about your knees or anything else. So this is Jonathan Ginsberg, wishing you the best. Thanks a lot. Hi, this is Jonathan Ginsberg, and I hope you found this video helpful. If you'd like to know more about how to win your Social Security disability case, I'd like to invite you to download my Secrets to Getting Approved Early Survival Kit that I created just for people like you. Currently, I'm making the Survival Kit available at no cost, and I encourage you to grab your copy now. Some of the topics I cover include: how do I know if I have a case? Is it the right time for me to file my claim? 9 common mistakes that can doom your case. The 3 must-have arguments you use to win your case. And a topic that every disability claimant wants to know: how to avoid trick questions from the judge. If you or a loved one need to win Social Security disability benefits, you'll find the Survival Kit essential reading. Download your Survival Kit right now and at no cost. Just visit ssdanswers.com/survival and sign up. It's that easy. Please act now. And as always, I wish you the best.